Hello once again to all you listeners out there. Maybe you're viewing this on YouTube as well. Whatever it is, we're giving you a big old air hug here with the Just Start the Conversation podcast. It is brought to you by St. Luke's University Health Network. My name is Kevin Crockett. Very happy to be back with another episode 18 now in the books with the Just Start the Conversation podcast. And a very special guest is joining myself and host Jody McCloud Missmer. Jody, good to see you again, my friend. It's been a little bit.
It has. It's really nice to see you too. Sorry I missed last time, with the whole, I'm not feeling great. You never know what you're going to be passing to someone. So I thought it'd be kind to leave Dr. Thomas and Amy a little bit safer. So it's nice to see you. It's been a minute.
It has been a minute. It is great to see you as well. And joining you today, we've had a lovely conversation off the air. Now, Dr. Warholic, I don't want to put any pressure on you, but you told me about this magical run you've had through television. So we're expecting big things from you today in this episode. This is Dr. Holli Warholic with the Obstetrics and Gynecology Department at St. Luke's Riverside Women's Healthcare. Thank you so much for joining us today, Dr. Warholic. We appreciate it.
Thank you for having me. I'm excited to be here.
Okay. I mean, again, no pressure, just, all that TV background. I'm minding my P's and Q's over here. Well, listen, ladies, it's been nice with a nice warm introduction here and a little bit of laughter, but a very serious conversation ahead of us today. As often is the case with the Just Start the Conversation podcast, one of the things I think that I enjoy doing with you, Jody, and that we've done historically with Amy is kind of take some of these tough topics to start having conversations about. And certainly that is the case today as we get ready to talk about perinatal loss. Dr. Warholic, I'm going to go ahead and start with you. Can we just kind of go into what that is and kind of the most simple definition we can kind of give to people about that?
Sure. It's probably the hardest part of my job. Mostly we're dealing with happy events, but perinatal loss is when a family experiences loss during pregnancy or shortly thereafter. And a lot of times it is completely unexpected, which is a lot of emotion, a lot of questions that don't have answers. So it's a very difficult time for these families.
Jody, I want to kind of turn to you. One of the things that we've discussed quite a bit in this podcast historically has just been trying to understand your feelings, trying to understand your emotions. And this, look, I think to Dr. Warholic's point, this typically starts as a very exciting time, a very happy time, and can be a very difficult kind of turn of events. Can you just kind of go into some of those emotions, that they're okay to feel those emotions, and just kind of, I hate to say what that experience may be like, but just some of those emotions you may feel in that time? Sure.
So I think I'm going to take it a little bit back to, I am a mom. I have two children who are Earthside. So I have experienced pregnancy, but full disclosure, I have not experienced loss. But what I can say from the professional side is anxiety is a very common experience for any pregnant person, right? So anxiety, whether there is a successful Earthside birth or there has been former perinatal loss, anxiety is a component to pregnancy that is not uncommon.
Correct.
Yeah. So I would say that's an area right out of the gate that as women, we need to recognize. And I would add to that some individuals prior to pregnancy are already anxious people. So it's natural to feel anxious during your pregnancy. Then be aware of where your anxiety levels were prior to pregnancy so that you can pay attention to that. And I would say that the component prior to that to pay attention to is control. So if you are an individual who is a planner, who you like to control things, and I don't mean this in any negative way. I just mean if you're the one who knows at 9:00 when you visit the park, you're going to go on the slide at 9, and you're going to go over to the merry-go-round, and then you might get dizzy. So then you probably want to go on the swings, and then you probably want to go back over to the slide because you have to control the environment so that nobody gets too spinny. Paying attention to that control factor is very, very important, because when you're pregnant, the control factor, we look to folks like you, right, to to control the rest. So you're supposed to take care of that, doc, right? Like
Right.
that's, but I would say anxiety, Crockett, is the piece that I think we're going to focus most on here. Fear of the unknown, lack of control. And I would ask you, I mean, what do you see?
I mean, I think there's a lot more infertility, I think, that we're dealing with. So there is a whole lot of anxiety leading up to pregnancy. And then, you get that magical test and you're so excited and you can't wait to share, but we try not to share because you want to make sure everything's okay.
Sure.
So there is a lot of emotion. You start planning, you start thinking of names, you start, thinking about your nursery. But it certainly is a moment when women who've had control over everything and now, like, we have to trust the people we choose to take care of us to get us through this pregnancy and hopefully have a great outcome. And sometimes, we get thrown a curveball and everyone's just kind of like at a loss for, how this happened or why this happened. And the anxiety certainly continues afterwards.
Sure.
And then not even getting into like a subsequent pregnancy after a loss is often extremely difficult for families as well.
So you mentioned everyone. What do you mean by that? I mean, isn't it just me as the woman? Like, I'm the one who's pregnant. I'm the one who experienced this loss. But you said everyone.
Right.
Why?
Because it's important to include the whole family.
Okay.
I mean, you are our primary concern as the pregnant person, but all those people supporting you are also important because they're going to help you through. I can't be with you every moment of the day, but if I know you have good support, that helps me to do my job. And we have checked in with family members on a patient who experienced loss, just because sometimes I think you get more information from the people they're with every day than when a mom comes in to see me and I'm checking in on her and it's her 4-week checkup. She's like, yeah, I'm okay. And then I turn to Dad. I'm like, is she okay? And he's like, well, she's not sleeping. She only eats once a day. So I think sometimes you get a lot more information from the family, and we always try to keep it like family focused.
Right. That's so important to note. Crockett, I know you had a couple questions about that, or at least wanted to get some information on that. You're certainly coming from the other side, since I'm assuming you've never been pregnant.
Right. Well,
yeah, I'm
your
just
assessment
assuming.
is fair.
Excellent.
Thank
excellent.
you. I think to kind of touch on some points when you guys, it's funny you mentioned, Jody, that your two children were Earthside. I'm very fortunate to have the same circumstances on my end as well. And you mentioned women who are anxious and really like to just have control of. By the way, I just got back from Disney World. Ask me who planned that whole trip.
7 a.m.
so-
Genie? Were you on the 7 a.m. planning the whole thing?
You better believe we were waiting at those bus stops, ready to go to whatever park we were going to.
Yeah,
by
I'd still be
8
in bed.
o'clock, 8 o'clock, sunscreened, ready to go. But to come back to kind of both of your points, to kind of touch on, again, I mentioned my wife was an anxious person to begin with. Being pregnant only kind of ramped that up a little bit. And Dr. Warholic, as you kind of mentioned, you'll maybe turn to that significant other as you're talking during a pregnancy about what, kind of what's actually really going on here. Are we sleeping? Are we doing all of those things? A situation like this happens. You're experiencing that loss. Can we just kind of go into, it's unfortunate that you can't control the circumstances, but now the circumstances have presented themselves. Kind of coping with those anxious feelings now that this moment has happened, and it's time to kind of, I don't want to say move on, because I don't think that's the right term, but these are the cards that we've been dealt. We've got to play this hand now. And the significance, not only, just for the women themselves who are experiencing this, but as a couple, kind of trying to take those first steps in trying to cope with the unfortunate circumstances that have presented themselves.
So I lost my train of thought for a second because you said something that I wanted to focus on. Moving on. So you're right. We don't ever move on from these experiences. These families kind of learn to live with it. And some days are way harder than others, and as they grow their families, they always want to remember their baby that is in heaven now. And I think, one thing we try to focus on too, and this is something I learned along the way. I certainly didn't know this when I experienced the first patient who lost a baby, which I remember very clearly the circumstances of that. I remember which room I delivered her in. And one thing I think that's important that I've learned along the way is to say their name.
Yes.
And these parents love it when you use the baby's name and that you bring them up because they are a part of their life. And it's very important.
So you did that.
I did that. I tried to do that.
I have a grandson who passed away in March. So it was a year in March, and he was stillborn. And one of the things that Holly said was, "What's his name?" And his name is Creed. And we just celebrated his birthday, and he has a little sister, and all those pieces. But I thought that was very interesting. You certainly practice what you preach, because that was before we started our conversation today, Crockett, and she stopped me and said, "Well, what's his name?" And his name's Creed. So I think I've learned that too, to be fully aware. I mean, as a grandparent, I say to my oldest all the time, she has taught me so much, so much. Things like, and I know that this is just starting the conversation, so we have a brief time, but she taught me that when Creed was born, that she had the option of getting his footprints and handprints, and all of the things that happen when you have a live birth can still happen when you have loss. And that blew my mind. And I was hoping maybe you could talk a little bit about that. You know, what can they expect, and what are their options? What are their options?
Yeah, so there are a lot of options, and some patients and some families want these memorial things, and I have patients who don't want it, and that's how everyone deals with their own grief. So we do footprints, and we have photographers who are actually trained in loss photography who can come to the hospital and take photos of the baby with family too, if they desire. We have cuddle cots, which helps to preserve the baby, so you can stay with the baby as long as you want after the baby, after the delivery and stuff. Because sometimes patients want to hold the baby and walk away. Other times patients need time to grieve, and the cuddle cot helps to make that possible for a longer period of time than we would be able to in the past. We do have always pastoral services on campus who can come and talk to the family and pray over the baby or whatever their needs may be at that time.
Wow. Yeah, it's interesting, Crockett. It was just very eye-opening for me, and learning all of that and knowing the options. And I think for those individuals who are listening to this, you may have a friend or a family member or yourself who experiences this sometime in the future. And I think that it's important for individuals to know that those are all still available to you, that the experience is still, I don't even want to say permitted, but it's still welcomed. And it's still okay. And I know, I think that's an important piece, that women and families be educated to understand what can and what can they have happened. I would have never known that you could, have, a lost photographer. And when we have this conversation today, I hope people realize that this conversation is not intended to be morbid. We've talked about grief and we've talked about loss before. It's really an opportunity for individuals to have the experience they need to cope.
Right.
First of all, let me say thank you to you both for having that conversation, because we've certainly, Jody, I'll speak on behalf of Amy and myself, we've all had conversations about our personal lives in this podcast. Thank you for that, because I'm sure that was a lot, and I appreciate you being so open and honest about that. And one of the things that I think are so wonderful about a podcast like this is sometimes these conversations are very hard to start. And what a podcast like this does is it brings a community together. There are people that would listen to this episode because this is what they're experiencing. And I think that that is such a strong asset in coping, trying to recover from what may be hurting our hearts. And so to be as open as you both were in that conversation right now, thank you, because there were some elements there that I certainly was not aware of that I think were beautiful and wonderful. So just as a side note in this, if I haven't said it enough already to both of you, thank you, because that was wonderful. Dr. Warholic, I kind of want to come to you with that idea of community in this space, because I'm sure that just as much as families lean into one another when unfortunate circumstances like this present themselves, you are leaning on your doctors, you are leaning on your caregivers, you're leaning on friends or family. You might be checking Facebook groups, you might be going into all of these different spaces that just as much as you were preparing for a child to come into the world and trying to get as much information as you can, now these circumstances are here, and now you're trying to get some information on, okay, how can I embrace my anxiety and cope and kind of continue on. Can you kind of talk about the community? Because I'm sure that that is a very special place for women in particular, but obviously for families, just the kind of community you see in circumstances like when it comes to perinatal loss.
Sure. So prior to, of course, COVID, we had a loss support group that met, and there was a couple in the Lehigh Valley, and that kind of, as many things did through COVID, kind of got put off to the side. And we are bringing that back actually next month, and I'm in May. So I'm super excited to have that opportunity for parents. We invite families. It doesn't have to just be mom. It can be dad. And, a lot of times the dads will kind of go off to the side in their own little group. But it gives them all, I think, the support to know that, number one, they're not alone, which I think is important for them to realize. They build a very strong community. And one of our families, I know the mom has traveled to locations across the nation to visit with moms who have also experienced loss. And they do a lot of things like with each other. One of the things, there's an event in the fall where you can submit your baby's name, and it gets written on a heart, and it's like the Hearts Release, Lehigh Valley Hearts Release, I believe it's called. And I know this mom will write names of babies she knows and include them in that event. So there's a lot of community support across the nation, I think, but certainly in these small groups that we have here, and the turnout for that event is incredible. I've gone a few times over the years, and it's just amazing to see all the families there.
We'll have to see if we can find the information for that, Crockett, and share that for sure. I would assume it's open to anyone who, okay, that's great. That's good to know. We'll have to look that up and share the link in our show notes. Was there something before? And I'm asking this almost kind of naively. So the support group started a few years ago. Was there resources maybe lacking years ago? Have you seen resources improve in this area throughout your career? And can you tell us a little bit about that?
I feel like there was support, and I was a resident here, so I don't feel like I was involved in that type of thing, just because the way residency is structured is different. And then when you start, you're in a practice and you have your own patients, things certainly change. And I believe when, back then, there was some kind of support group that stopped meeting for whatever reason. I don't really know why. And then, all these, a few groups started to build up again. And they were going pretty strong before COVID.
Sure.
I know of 3 of the groups that were pretty strong. And now I think maybe one meets and they only meet virtually. So getting back into in-person support is one thing that my patients have told me was very helpful to them during this experience.
It's interesting, Crockett, we've talked a couple times throughout the last almost 2 years, I guess, that we've been together. There are different levels of therapeutic support that individuals can experience and can engage in or choose not to engage in. And support groups are one of those that you get to share in lived experience. Support groups are different than therapeutic groups, and they're different than one-on-one therapy because there is not necessarily a therapeutic expert present who guides the process. When we talk about Group therapy, we're actually talking about individuals in a prescribed environment with a therapist actually leading the processing and overseeing that milieu. In a support group, it's much more free flowing. There are usually basic guidelines, to be respectful, perhaps to maintain anonymity if that's the type of group it is, but then there is the group therapy process and then the one-on-one therapy. So I think it's important for people to know that there is as casual as a support group. Actually, I should even back it up further. There's as casual as a Facebook group,
right,
where you truly can be anonymous and hear experiences. You might even just follow someone on Instagram who's walking this walk. And then the support groups, and then if you think about it, individual therapy and going forward from there. But there are options out there. There are also specialists out there in perinatal loss. Right. And at St. Luke's, we actually do have some embedded psychotherapists who are LCSWs and LPCs embedded in certain OBGYN practices. And I think it's important for people to know that just because you are not a patient of that OBGYN office does not mean that you cannot access that therapist or those therapeutic services at those locations. And we're continuing to build and grow that service. Because you mentioned something in the very beginning of this conversation I thought was interesting. You said infertility has become, and I don't want to put words in your mouth, but there's a higher rate of infertility, and I got the impression, and please correct me, that from that you see a higher rate of perinatal loss, or was I misunderstanding? Please help me.
Okay, no, I was just speaking to that as to the amount of anxiety women have.
Gotcha. Okay.
Like going into pregnancy.
Okay. I just wanted to clarify that because I thought, oh, what? Okay. So it's, I guess, Crockett, my point in bringing all of that up is there are a lot of avenues that individuals can seek help and information. I always say, and if Amy were here, Amy would say this: stop Googling if you're an anxious person. Stop Googling. That's her big thing.
I keep my show notes. I don't know if you can see right there. It says Google, because that's exactly where I was going with my next question.
Stop Googling.
Stop Googling. Yeah, well, I want to come back to a little bit of what you said there, Jody, because I think especially from who would be a support system in this case, I know that I would be trying my damnedest to do whatever I could to try to, if my wife was having a particularly rough day, to try to make her, quote unquote, feel better in whatever way that I could do that. If you're going through this process in the Facebook groups and support groups and individual, like if you're a significant other in this situation, and I guess I'll kind of keep this open to both of you to answer.
The answer is yes. Just if you want to know.
I agree. Listen, I think one of the things, there's been no doubt that if there's anything anyone's taken away from this podcast in the time that we've had it, it's been go to therapy. But not so easy for right. others to embrace and do. But if you are in that role of a significant other, and maybe you have done some support groups together and you're both on the Facebook groups and you're talking about, hey, did you see this? This is kind of what we were talking about the other day. At what point I don't want to say at what point, because there's no defined one for any one person, but the best way to maybe approach your significant other and say, hey, this might take a little more than just a support group. I think maybe you should talk to somebody one-on-one and really get whatever you're thinking and feeling and holding and just get it out there. I guess that's kind of the question here. And Jody, I'll start
Sure.
with you since you kind of started in that direction, but just at what point is a significant other it is, I don't want to say the point, because again, there's not one, but just, right. Hey, I think you should really go and talk to a professional one-on-one to kind of, let things air out a little bit.
Yeah, I think it's similar, Crockett, to other conversations we've had. And that is, if you notice that your significant other, whether it's the woman recognizing that the man is experienced or the man is recognizing that the woman is having an experience, it's those things we look for. Sleep, you actually mentioned it too. So sleep disturbances, eating disturbances. Perhaps there's some isolation occurring. Perhaps there's some heightened energy elements that are uncharacteristic, almost manic in nature. I think it's important to notice changes. Certainly you're going to be changed. I think that's the important piece. Right. But I think, Crockett, what you're asking for is, okay, when do I kind of raise the flag and go, whoa, 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 hold on a second. I think it's when you start to notice those daily living activities that are disrupted, and disrupted to a point and a prolonged period of time where there's concern that this is now becoming habitual and not healthy. Certainly there's going to be disturbances in the very beginning. Right. We expect those things. And I would liken it back, Crockett, to our grief episode, where individuals will grieve for the rest of their lives, but you begin to grieve differently. But I'm wondering, from a physician's perspective, when do you as a physician say to your patient, I think you need help?
So we do a questionnaire when they come into the office, and that takes a little bit different spin when it's a loss.
Sure.
Because the questions on the questionnaire are rather difficult. So we have to work on that a little bit.
Okay.
But, talking to the patients, again, talking to their partners. I've had partners call the office concerned for their significant other. We bring them in for an appointment, and you can kind of gauge. Once you go through this experience with a patient, you have a different connection.
Sure.
And, they come back and see us usually at 2 weeks, then we bring them back again in 4 weeks. And from that point, we kind of gauge where we need to see them again. And, sometimes they need to be seen more frequently. And sometimes their family member calls and says, I'm worried about them. So we have our nurses call and speak to them, offer them counseling services, and bring them into the office for an appointment as well.
Okay, I'm going to ask a question because I think listeners will think this. I know the answer, but I think it's important to say it.
Okay.
So you said, I'm pregnant. I experience a perinatal loss. Deliver my baby. I choose to have handprints, footprints. I have the loss photographer come in. I use the comfort.
I can't remember what it's called now. I said it earlier.
No, that's okay. It's okay. There's something that can come in that allows me to spend extra time with
Comfort cot.
Thank you. No, that's okay. Hey, we're human. And then I leave the hospital, and I'm still following up with you in 2 weeks. And then I'm seeing you in 4 weeks. And my family can still call you and call the office after that time period. So the support doesn't end.
Correct.
And I say that because I think in some people's minds, there's an end to that.
Right.
So it may seem very simple for you to say, I see you in 2 weeks, I see you in 4 weeks, but it's actually not as apparent to people as you would think. So I think that's important for people to know, is that the support continues. You're my doctor.
Right.
And you continue to be my doctor, right? And continue to support me. So I think that's important. And to know that your loved ones can call and express concern, and the fact that you have a nurse that follows up, I think is great. I think that's wonderful. Yeah, you're welcome.
Well, listen, certainly not an easy conversation to have when it comes to perinatal loss. I want to thank you both for your information today, particularly Jody. We've had a lot of intense conversations in here. I don't know that as the dad in me, I send love to you and your family.
Thanks, Crockett.
That was about as personal as it gets. So thank you for sharing that information with us. I'm going to try to keep my eyes dry as I'm trying to read here. But Dr. Warholic, excellent insight.
Yes,
I think for everybody out there that's wrapping up here, there is support. There is a community. You can find it with your doctor at St. Luke's. You can find it with your family. You can find it on Facebook. Don't go down Google, but find it on Facebook. Maybe check for one of those groups where a lot of people are trying to reach out there with arms wide open to bring you in what is certainly a tough time. So to both of you, Jody McCloud, Missmer, Dr. Holli Warholic, thank you for a very open and informational conversation today. Thank you both.
Thanks, for
Crockett.
having me.
It is the Just Start the Conversation podcast, and it's brought to you by St. Luke's University Health Network. My name is Kevin Crockett. Wrapping up episode 18. You can find this at sluhn.org, wherever you get your podcasts, YouTube. It'll be up there as well if you want to check that out. Certainly, if you know somebody that could use some of this information, we encourage you to share this podcast as well. So thank you once again for tuning in to the Just Start the Conversation podcast.